The kind of girl that you could be down for. 'Cause when I look at you, I feel something tells me that you're the kind of girl that
Yeah, whatever. Don't let her trick y'all. I'm being for real. I know her, honey.
I could be longer. Like something could be going wrong.
I want to be 60 years old. Nobody gonna tell me what the fuck I can't do.
There ain't no one for me, only you. I wanna be down. I wanna be down. You don't make it time. I wanna be down.
Okay, y'all, I'm excited. I am on my way to the appointment. Y'all, it's been a long time coming, and I am so excited. I'm praying for some good news.
In about 2 miles, turn
I'm
left into the
praying
parking lot.
for a surgery date to come out of this. I know I ain't gonna know today. I don't know. I might not. I don't know how to go. But I'm praying like crazy that I finally get this solution. I'm just praying to God I get the solution. Like, seriously. It's been a long time coming, and I just, been frustrated. But everything happens on God's time, so I understand that. So make sure y'all say a prayer that I get it. But in the meantime, make sure y'all like, comment, subscribe, tap that notification bell so y'all know every time I post. Like with Jody. And yeah. I'm just so happy. So happy, honey. Oop. Let's get here and see what they're gonna say. I'm praying for some good news. Yes, I am. And tomorrow night I got an appointment. And then next week, Kyrie got an appointment. People always got appointments around here. Somebody always got something going on. Go ahead. Alright, Pepsi. Oh my goodness. Alright, y'all, we almost there.
Lying down and the leg cramping? Is that new?
No. It's just like when I lay on my back. The leg cramping. I don't know. Just be having pains.
Okay, because when people, if you get short of breath when you lie flat, that could be a heart issue. Have you gotten that checked out?
Oh, yeah. Mm-hmm.
Okay.
Yeah.
Okay, what did they say it was? Nothing?
Nothing. He just did the heart thing on me, where he recorded my heart.
Okay, you've seen a cardiologist before?
No,
A heart
doctor.
monitor. Okay.
But it's more of like when I'm laying on my back. Like if I'm on my side, then it's not.
Okay. Okay.
So I don't know. Yeah, my doctor did an EKG on me as well.
Okay. All right. And then regarding your back pain, how long have you had that for?
Years. Before I had kids, it's been years.
Okay. Yeah, I saw you're in that group therapy at Mary Free Bed for the chronic pain. Has that been helping?
Well, I finished the program already.
Okay. Did it help?
It was an 8-week program. A little bit.
Okay.
Yeah.
Okay. Have you seen like a chiropractor or anything for your back pain?
I'd never seen one.
Okay.
I just did physical therapy.
Okay. Okay. Does the physical therapy help? Okay. And as far as pain meds for that, you're on the Flexeril, Motrin, Naproxen, Tylenol, lidocaine patch.
Mm-hmm.
Okay.
I was on the Gabapentin. Yeah, I can't.
Gabapentin.
You got it.
Okay.
Yeah, my doctor had it.
Okay.
Tried that for me
Okay.
a while ago.
And then otherwise some anxiety, which you're on medications for, and then I saw that your primary care doctor put in a referral for a psychiatrist for that. Okay, perfect. Do you have an appointment scheduled with him or her yet?
It's in my chart.
Okay. Okay. Sounds
I want
good.
to say in October. That was
Okay.
as soon as it. Yeah.
Wonderful. Then you're also on Wegovy, right?
Yeah.
And that is for weight loss?
Mhm.
Okay. How long have you been on that for?
Well, I can't.
No worries.
Yeah, I can't remember.
How much weight are you trying to lose? Do you have like a goal weight in mind?
About 140.
Okay. And what are you at now?
157.
Oh, you're almost there. Okay. Are you, is it just with diet and exercise as well?
I do walking.
Okay.
Yeah.
Okay. Have you lost a lot of weight in the last?
Yeah, I lost 100 pounds.
Oh my.
I was 230. So,
Okay.
yeah.
Congratulations. That's
Thank
a big
you.
deal.
Yeah.
And was that over the course of months, years? Months. Okay. So you're still actively losing weight.
I am.
Okay. Okay. Good to know. All right. Just want to talk about all that before we move on to the breasts. What size are you in bras now?
Is it 40H?
40H.
It's
Okay.
41 or 40H.
Okay. You've been that size for a while now.
Yeah.
Okay. Okay. What size would you like to be ideally?
B or C?
Okay. Are you having neck pain from the breast? Shoulder grooving? Okay. Do you get rashes under your breasts? Do you do the creams and stuff, like the antifungals?
Yeah, it's. I forgot what it's called. My doctor
Nystatin.
prescribed it. Yeah, prescribed for me before.
Right, does it help?
Not really.
Okay. Okay. All right, and then, but you've had, as far as your back pain, you know, it could be related, because it could be related to something else. It could possibly be related to your breasts as well. It could be like a combination of multiple things. All right. Any history of breast cancer that you have?
No.
A family history of breast cancer?
No.
Have you ever had any mammograms or ultrasounds?
Mammogram.
Okay. When was that?
3 years ago.
Okay, because you are, how old are you?
38.
Okay. Why did you get one 4 years ago?
So they did a ultrasound, and they see like a lump or something.
Oh, you thought the lump or something?
Yeah.
Okay. Okay. And did you get it biopsied or anything?
Yeah.
Okay. It was normal?
It was normal.
Okay. Sounds good. You said no breast cancer in your family either.
No.
Any history of blood clots in yourself or bleeding disorders?
No, not.
Okay. Any history of blood clots in your family that you know of?
Not that I know of.
Okay. How many pregnancies and how many kids?
3 pregnancies and 2 kids.
Was one of them a miscarriage?
I was 5 months, so I don't know. But I went to early premature labor.
Oh, okay. 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 All right. Okay. I just asked that because sometimes when people have multiple miscarriages, that could be a sign that you have like a bleeding or a blood clot disorder.
Oh.
But if you've only had, I guess that's very different.
That was the first pregnancy.
Yeah. Okay. Okay. All right. If we go over this, and then any plans for any more kids or anything? Okay.
Nope.
Okay. So, breast reductions are wonderful surgeries. They're some of our happiest patients. We can talk about how exactly we do that. First, I'll do an exam. I'll get Ashley to come here and help me just to chaperone. We'll do some measurements, and then we'll talk more about the surgery. Okay? Okay. I'll be right back. And then we're going to take some pictures too that'll just go straight in your chart. And that helps with just like preoperative planning, and then to send to your insurance too. Okay, when it comes to that. Okay? All right, be right back.
Thank you.
So what the surgery entails, the incisions that we make, so if you have your breast here, and then your nipple and areola, so right now it's way down here, right? It's like pointing toward the floor. That's very common, especially after having pregnancies, kids, and weight loss too, as well. But really, surgery, we would be raising up your nipple and areola up to a more, your position where it should be. In the incisions, to remove that excess breast tissue, is to make an incision. You make it around the areola, and then down the center of the breast, and then on the underside of the breast, like in that fold. Okay, and sometimes we carry it out laterally, way out here, just like under your armpit. Okay, so they're pretty long incisions, but that's just what we need to get all that, breast tissue out of there. Okay, given how big you are now, I can only take off so much safely. So I don't think I could get you down to a B. I don't think that would be safely possible, and I'll explain why.
Okay.
We would probably be able to get you to like a D or something like that. And also, I don't always like to use sizes because it depends where you go, right? Like Victoria's Secret's like very different than like JCPenney or whatever. But the reason I can only take off so much safely is that we have to keep this nipple alive through the blood flow through the breast. So the nipple, it's not like we take it off and then reattach it. It stays attached to your breast tissue, okay? So we have to keep enough tissue there to provide blood supplied to that nipple to keep it alive, okay? So that's why if I were to make you too small, like a B, your nipple would die. So we don't want that. Does that make sense though? Okay. So that's one. And then we can just go through some of this and we'll give you a copy of this.
Okay.
Let's see. So it's affecting, the size of the breast is affected by puberty, growth, pregnancy. So if you were to get pregnant again, that could affect the size of the breast. It also might affect your ability to breastfeed. Usually about 50% can breastfeed after a breast reduction. And those who can usually just have to supplement with formula as well. Okay. It can also be affected by weight gain or weight loss. So usually we like to have people at their goal weight, which you're pretty much almost there, or you're pretty much there, at their goal weight. And we also want it to be stable for 6 months. That's just going to give you the best result, especially since you've lost 100 pounds, which is like amazing, because if we did this breast reduction like a year ago before you lost this weight and then you lost it after, then your breast would just be totally deflated and make it become saggy again. Okay. Does that make sense?
Yeah.
Okay. So I think it would just be in your best interest, just to give you the best result, to have your weight stable for 6 months. So if we say now, you're 15 pounds away from your goal weight, that's close enough, I would say.
Yeah.
So I would probably for you recommend at least waiting 6 months to do the surgery. Making sure your weight, because if you were to lose another like 70 pounds after surgery or something crazy like that, it would affect your result. Does that make sense?
Yeah.
Okay. So, excess weight from the breast can cause like back pain, shoulder pain. It might be contributing to your back pain. I know you've had some issues with your back for a while, it sounds like with sciatica and things like that also.
Yeah, but I've always been at the top, so.
Okay. So, a lot of our patients do get relief of their back pain after the surgery, but we can't guarantee that it'll completely get rid of it. Okay. Talking about aging too, with age, as we get old, everything becomes saggy. That's just something that's unpreventable. Talked about scars. Your breasts look pretty similar size. Do you think one's bigger than the other? Okay. Yeah, we usually say, they're sisters, not twins. So when we do the procedure, we try to make them as symmetrical as possible, but they're never going to be exactly the same, and that's just how the human body is. Okay. Let's see. You want to do liposuction because that your breasts are just too big to do that. Talked about this.
So I think you get liposuction with breasts?
Yeah, that's more for like older individuals. Because as you get older, your breast gland is replaced by fatty tissue. They just wouldn't work. You have too much skin. Like you have
I didn't want it. That was just something new I've heard. I've never heard of that.
Some people do, but it's a very particular patient. Okay. Cancer, this is incorrect. It actually does decrease your risk of cancer a little bit. You're only 38, so we don't need to get any imaging beforehand since you don't have a history or a family history of breast cancer, so we won't need that. So the procedure is under general anesthesia, so you'll be completely asleep. The procedure takes about like 3.5 hours or so. You wake up and you go home the same day. You won't have any drains or anything like that. You'll have some waterproof dressings in place. You can shower 24 hours later. Just let warm soapy water. Okay, so but we'll talk about that again when the time comes. But let me just make sure that these save again. These save. So I think the priority now. So right now, what I'll do is I will send a letter to your insurance, and then they usually take about like 4 to 6 weeks ish to get back to us anyway. But I think you should be at your goal weight for 6 months or so. Okay, I think that would just make your result just give you the best chance. Okay, so I think maybe we should we can follow up in like 3-4 months and then see how you're doing. We can do like 3-4 months, whatever works for your schedule.
Okay.
But I'll get that process moving now with your insurance.
Okay.
So then, by the time you're ready for surgery, it'll be all done. Okay. If there is a chance that insurance doesn't cover it, which I doubt they won't cover it, but sometimes they don't. Then you have to pay out of pocket, and we would give you a quote for that.
Okay.
Okay. All right. So let me there's just one more thing. Dr. Zommerly, she's the attending surgeon who's covering the clinic this week, so she's just gonna pop in and see you.
Okay.
Then we'll go from there. Okay.
Okay.
All right, y'all. So I go see them in January for, I don't know, like, I go see them in January for a follow-up, and then I will know everything, like what date is surgery and all of that. So yeah. Well, they gotta go through my insurance to see if my insurance gonna prove it, but she said, yeah, they're gonna approve it because I'm a good candidate for it. So yeah, y'all. Hopefully, dang, that's crazy. If I have surgery in February again, my last surgery was in February. So yeah, I'm excited, guys. I am excited. I got some answers, so I'm happy. I can't wait to get rid of these things. Yeah. Thank y'all. Now hang it up.
Oh, end it?
You heard me.